Hello, everyone. The topic we gather to discuss today is as profound as it is universal, and it is about the growing incidence of suicide among our young people. Across the globe, in every community, every country and every community, we've seen an unsettling rise in the rates of suicide, particularly among teens and young adults. From 2000 to 2021, suicide rates increased in the United States by a staggering 36%, claiming over 48,000 lives in the year 2021 alone. This is not, obviously, this is not just a number, this is not just a statistic. Each point represents a life, a world of potential tragically cut short. And each life lost sends shockwaves through families, schools, friends, and communities, leaving in its wake a lasting mark of pain and grief. Despite the vast cultural, societal, and economic differences that span our globe, this is a shared struggle. It's a human struggle, cutting across boundaries and borders. The common threats, mental health challenges, family dynamics, exposure to violence, social pressures, and access to lethal means make it clear that this is not an isolated problem, but a collective one. Today's conversation is a stepping stone towards a global unified response to this pressing issue. So let's lend our ears, open our hearts, and strengthen our resolve as we embark on the crucial discussion. To address this, we've gathered a panel of distinguished experts, so let's call them on stage. John MacPhee, CEO of the JET Foundation, Louisa Benton, Executive Director of the Hope for Depression Research Foundation, Amy Kennedy, co-founder of the Kennedy Forum, and Paul Yip, Director of the Hong Kong Jockey Club Center for Suicide Research and Prevention. Welcome. Later on, Flora Papitsi, a psychologist of Regeneration in Progress, will also join the discussion.
Thank you so much. And thank you, everybody, for being here, and to SNF for hosting this extraordinary conference. I want to thank our panelists for joining this morning and look forward very, very much to this discussion about youth suicide. As noted, the panel includes Louisa Benton, who is the Vice President and Executive Director of the Hope for Depression Research Foundation, Paul Yip, who is the founder and director of the Center for Suicide Research and Prevention at the University of Hong Kong, and Amy Kennedy, who is the co-founder of the Kennedy Forum. Okay. So, we wanted to start and just give you a little bit more framing about youth suicide in the context of the world. And this chart shows you the suicide rate per 100,000 people. You'll see the suicide rate among these countries is highest in the United States, and that the trend among the whole population is rising in the United States. In some of the other countries, the suicide rate among the entire population is going down. But the primary point that we want to make here is that you can see across all of these countries that the suicide rate among the young, ages 15 to 24, is going up across the board, with the exception of Australia, where it's flat, right? So this truly is a major issue. You can see it in the media, right? There are lots of reports in the media from multiple countries here, South Korea and Japan, about the youth suicide rate and how it's rising. And more coverage here from Singapore and from the United States. And in fact, in the United States, just recently, in the past months, the Surgeon General of the United States has declared a youth advisory, has also declared an advisory related to a growing epidemic of loneliness and isolation among the population, and has issued a third advisory about a growing body of evidence about the potential harm, the harms really, of social media and our need to act on that because as the evidence grows, obviously social media is having an impact, and in some cases, in many cases, that impact is harmful. So there is a lot happening around young people. At the beginning of this conference, Dr. Kopowitz from the Child Mind Institute talked about the fact that symptoms emerge of mental illness in 50% of the cases by age 14 among young people. But it takes many, many years for an accurate diagnosis to happen, right? So young people, when we think about protecting the mental health of young people, we need to think about 20% or so are going to have a mental illness, and that mental illness is emerging in youth. It's critical that they be noticed and they be referred to care and accurately diagnosed. But in addition, young people are dealing with a lot more. The macro environment is incredibly stressful, and we heard this from other panels. COVID, climate change, safety and tensions around racism. In the United States, shootings, school shootings, right? And young people are feeling enormous pressure to live up to expectations. Income inequality, which we've heard about, is putting pressure in this sense about sort of a binary sense about success or failure. And you can look at the list here in terms of all of the pressures on young people. And these are all in scope and things that we need to think about when we think about how to protect young people and reduce risks of suicide. So what I'd like to do is ask each panelist to just take a minute or two to let the audience know about yourself and your work before we dive into this discussion. And Amy, let me start with you, and then we'll come this way.
Sure, thanks, John. I really came to this work because I was first a public school educator. So I worked with middle school students, and in my time as an educator, although I had not had training around mental health, I could see very clearly the struggles that my students were having. And for a very long time, you know, we thought that was just bad behavior at school. And as our awareness has grown, we're able to identify that as depression and anxiety and other influences that are creating some of the behaviors that we see as challenging in schools. And now my commitment has continued to grow as the mother of 5 kids. To that earlier statistic John said, you know, it's 1 in 5 that will struggle with a mental health issue, and I think about the systems that we have in place and which one of my own children would I want to have go through the current system of care, and how can I be a part of the solution that's going to give them the best chance at a happy life.
Thank you. Paul.
Well, it's a pleasure to come to join these conferences, to be able to learn from so many esteemed scholars. And I've been working for suicide prevention in Hong Kong, for the past 20 years. And then we have been learning about not only to deal with the so-called the illness treatment, we like to work on the wellness promotion, because we firmly believe that prevention is better than cure. And also when you say 60%, I think, of the suicide death occur in the middle and low income country, and then where they might have only 10% of the resources. So I think it is time that for us to rethink and refocus and then try to do the suicide prevention more effectively.
Thanks, John, and thank you all for being here. I come to this issue primarily from a biological perspective. As the Executive Director of Hope for Depression Research Foundation, our mission is to advance the understanding of depression in terms of its biology in the brain. And to that end, we've built a consortium, an international consortium of scientists from labs all over the world that are coming together in a collaborative way to pool expertise and data to drive the science forward that we can then bring to the treatment and prevention of depression in actual patients.
Terrific. Okay, so looking forward to this discussion with all of you. As we start, because we hear a lot of statistics, I want to dimensionalize this just a little bit. Imagine that you all here are 500 high school students in an assembly, okay? So you're 500 students gathered in an assembly. In this coming year, in this coming school year, 200 of you are going to feel persistently sad or hopeless for a period of 2 weeks or more that prevents you from effectively doing the things that you want and need to do. 200 of you. 50 of you, okay, are going to attempt suicide. And 14 of you are going to require medical treatment for that suicide attempt. Okay? Just to give you a sense, that's just one assembly, one school, right? So I offer that as a way to try to bring the statistics to life. So given all of this, Paul, what do we do?
I think school is the most appropriate way, I think, to engage our young people, because that is the place where the young people, they would go. And also, I think it's very important, I think, to make the school is a happy environment, which is the young people, they like to go to school. They like to be connected. And also, we like to ensure the school system itself, the curriculum itself, should be diversified enough to cater for the young people with different skill sets. And also, we also make sure the school teachers are better supported in their knowledge of the mental health, and also to have the time and the energy, I think, to help our young people. In one of our studies in Hong Kong, I think we asked the school teachers to go to do suicide prevention. But then the school teachers themselves, they said, I feel suicidal too. You know, how can I go into the school, I mean, to teach the classes? So I think it's very important. Now, when we deal with the young school children, we should look at it as a system, not as a fragmented or disconnected measure. You have to do the whole school system and then make this whole school embrace this wellness, I think, this principle. And as a DNA, the program doesn't help to do suicide prevention. It's the school environment, the school atmosphere, starting from the principals and the school board, the teachers, and the parents as well.
Okay, so, you know, at the JED Foundation where I work, we work with schools to do this kind of work. And one of the keys to it is to make sure that the school and school leaders at all levels, right, at the government level, at the superintendent, whatever that position is, down into the schools, have a plan, literally a written plan for how they're supporting mental health and well-being of students. And Paul, you're talking a lot about culture, a culture of caring and connection, right, and belonging in the school as being protective and reducing risks for suicide. Amy, you're an educator and you've done a lot of work in schools, so could you add, you know, what does this make you think of, and could you add to this?
Yeah, absolutely. I appreciate that Paul talked about educator burnout and the fact that we really don't have the training we need for educators. When we think about how we're going to reach the greatest number of young people, we need to invest in that training, because it not only helps the young people, but it helps the educators themselves, who are, frankly, quitting at least in the United States, at unprecedented rates and leaving the profession. We know that by training them, they take that information back to their classrooms as well as to their homes and to their families. And so that training does not actually lead to an increase in number of students identified, but a higher quality in the identifications that they make in those students. So, you know, I think there's a fear that if you train more people around mental health, that then we'll have far too many students identified as in need of help. Rather, we're going to just see that they've done a better job at noticing who needs the right interventions. It extends beyond just the educators in the classroom. It's the entire school community, as you mentioned. It may be coaches, it may be the cafeteria staff. We are looking for kind of everyone in the building to have this training, and it would be at a, as JED does so well, multi-tiered systems of support. So that prevention level, all the way up to having a plan for students who need serious interventions because they have significant challenges, and making sure that the school has a plan through community partnerships for how to best address that.
Terrific. So a key theme then is prevention, and prevention in the places that young people are. I mentioned the Surgeon General's advisory earlier, and one of the things the Surgeon General called out in terms of ways that we can protect young people is through what he called supportive adults. And you're both speaking about that concept in the school system. How do we train, how do we activate supportive adults? Because we know that non-parent supportive adults in the lives of young people are incredibly protective to their mental health.
And I would just add, John, it's also training the young people themselves, because we know not every child's going to turn to an adult. They often seek help from their friends. So yes, they need to know when to have someone intervene and when it's serious and they've got to ask an adult for help. But training young people how to be a support for each other is going to be an important piece. Yes,
and undergirding all of this conversation is stigma, and which we've heard a lot about, and Glenn Close just spoke so beautifully about, and the role that we can all play in these settings and with young people to make sure that these conversations are okay to have. And a big part of what we can all do, and young people themselves can do, is starting those conversations, as Glenn said, so that it's okay, and that there's a culture of acceptance to talk about it and to say that you're not feeling okay, or to lean in and ask somebody, hey, you're not acting, or you seem different, is everything okay, can I listen? Louisa, you focus, as you said, on neuroscience and brain research. How are you and the Hope for Depression Research Foundation thinking about this issue, thinking about depression and mood disorders, which I know you focus on, which, of course, are also linked to suicide?
Yeah, exactly. Thanks for the question. So I just want to thank all the panelists for talking about the importance of community in the school and the sense of community there. We do know, and the CDC has stated, that is a really important protective factor for future mental health issues. The biology, that's coming out of the labs also supports this. We know that where some individuals can be very vulnerable to life stressors, there's also individuals that have a resilience to life's stressors. So what our scientists are really looking at is how we can enhance the natural resilience and how we can teach kids to do that. So another aspect of our work is to take the science into the schools, and we do panels with students to teach them about the brain, taking care of their brains. There's a lot of body positivity now, so let's have the brain be part of that. And we also do a lot of anti-stigma events. For example, we have a 5K teen race of hope in New York City that's organized by teens. So they're reaching out together from different schools, and it's really bringing them together as activists as well. So it gives them a vision of the future that they can all share.
Terrific, thank you. Again, prevention, early theme in our panel's discussion. I want to now at this moment invite Flora Papitsi, who is a psychologist here in Greece from the organization Regeneration in Progress, to address all of us, tell us about her work here in Greece and address the panel. Thanks, Flora.
Including me in the conversation. I will set more the stage about what the reality is here in Greece. As John said, my name is Flora Papitsi. I'm a psychologist. I'm currently collaborating with Regeneration and Progress, a non-profit organization which designs and implements free of charge a series of actions in the fields of health, sports and education with the exclusive financial support of the Stavros Niarchos Foundation. One of our main actions are the mobile medical units, which is an innovative primary healthcare initiative and program that aims to provide access to healthcare to the residents of remote islands and mountain areas here in Greece. They need to have equal opportunities and access to high-quality primary health care, and that is our goal. A team of medical doctors visits those remote areas, and in one day they practically set a hospital there for them to have access to primary health care. Its mission includes a team of medical doctors offering their services, even conducting some minor operations there, and also a mental health counselor usually accompanies every mission. Visiting myself a variety of those remote areas and seeing people with different cultural elements, I noticed some similar patterns in terms of their approach to mental health. Stigma, as the panel has mentioned already, is a significant barrier in mental health for people in remote areas. People are more hesitant to talk about their problems, and that is because they feel that they may get stigmatized or even marginalized by their community. Their desire to, or their accessibility to, or acceptability to receive mental health care for a mental health problem can be challenging because of that societal stigma that they feel that they may have to face. This is also closely related to issues of anonymity. In small communities, anonymity and privacy are particularly challenging in those rural communities. Because of societal stigma, community members may be embarrassed if one of their friends or a family member finds out that they are seeking mental health treatment. A provider also may be a friend of them or even a family member, and this could make them reluctant to reach out for help because they will be afraid that there will be a lack of anonymity. Individuals may fear being seen walking into a mental health clinic or to a mental health professional because they may deter them from seeking help, because they may feel that they will get exposed and that will deter them from seeking help. Recently, in one of our missions in an island, I came across a teenage girl who had been harming herself for several years, but she hadn't talked about it to anyone. She tried once to talk about it to her mother, but her response was that it's nothing significant, it's something very minor that you shouldn't care about. She came to me to talk to me, to ask for help. She asked me to talk to her dad because she felt like he was the only one who could help her, or at least show her the way to find some help. And I decided to talk to the dad to be the intermediate for her to get some help. Once I talked to her dad, long story short, he told me he listened for a couple of minutes and then he started saying to me, do not listen to what my daughter has to say, because we are a good family. We're not a crazy family. We have values. We love our children. We try to do the best for our children. We care about them. No one has nothing bad to say about our family. Not a single question about what his daughter is experiencing, why she feels that way, what he can do about it. The discussion was more about him proving to me that they're not a crazy family and that they are good people. And that's not because he didn't care about his daughter, but he realized the burden of the stigma that this situation would bring to their family. He offered to have a friend of him who was a mental health provider to talk to his daughter, but the daughter didn't want to because she was a little bit skeptical about the issues of confidentiality and anonymity. And the girl didn't have any other option, or at least it was the only option that her family could offer her. So, my question to you is, what can we do for that girl and every other girl and boy that is facing those same situations and circumstances in remote areas? And even more, a step further or a step backwards, what can we do in order for them not to be facing such situations and prevent them, as you talked about prevention? And before you answer, I want to add another component to our discussion. I saw myself and a medical doctor, me on my late 20s, a medical doctor on his 50s, and the dad on his 50s, talking about the girl and trying to speculate and imagine what it means to be like a teenage girl in a remote island and what she must be experiencing. But at the same time, we couldn't, because we're not that girl. We're not at that age anymore. She came to me to talk to me because I'm close to her age, and she felt like somehow we could relate to each other. She had tried to reach out to her teachers, but she felt that they couldn't understand her. So, to extend my previous question is, can we include those teenagers for the teenagers? Would it be better if she had the support for someone of her age? Or even have a campaign to look at that it would have been designed by someone young for those individuals that they're experiencing similar circumstances and barriers. Thank you.
Thanks, Flora. Stay with us, Flora,
yes.
okay?
Thank you.
Those are two fantastic questions that we are about to respond to, but I wanted to first just say congratulations and just acknowledge the incredible work that you're doing, and to point out that you're talking about both treatment and prevention. And we've started here with a conversation about prevention. But a comprehensive approach, a multi-tiered system of support, as Amy talked about, requires both prevention and treatment. And the fact that you're mobilizing mobile healthcare units, physical health and mental health, into rural areas that don't have access to care is an extraordinary example of the kind of thing that needs to happen, because people must have access to mental health care, and that's one of our greatest challenges. So mobile units, also using digital technologies and platforms, which you've heard about at this conference, is another way to do that. But you're also doing prevention. So when you're there talking to the family, talking to the father, et cetera, you're starting to move that dial, I believe. But this first question is about what do we do in families, and how do we move families around this issue? Paul started with a discussion about schools, but really family is the core community or unit. So Paul?
It's very true. I think whenever we talk to the teachers, they say that whenever there are problem children, there must be a problematic families. So I think it is all connected. So whenever we try to deal with the student problem, you cannot just address the student problem per se. You have to look at what is underlying behind, and then you look at the whole system itself. And one thing it has come to us very strongly, I think, when we read the death notes left by the young people, they have suffered from this relationship problem, the relationship with the parents. So I think it is a time, for the parents, I think, to talk to our young people, to communicate with them, to walk with them. I think we are always saying about the school children, they always say, hey, you give me a mental health program, but you never ask us, what do we want? What do we need? So I think this co-creation, bottom up. So I think as what Amy has said, we have done some program is in the school. I think empower the school, I think the schoolmates as a gatekeeper itself, how to build up a strong bondage and such that it can create a much stronger safety net, I think, for the student who are in need.
Yes. Louisa, yes.
I'd love to comment on this. You know, the parent-child relationship is foundational for the building of resilience and trust. It really is the root of optimism, and that's where it all begins. We have to acknowledge, however, that that relationship can sometimes not be there. And often when we're talking about suicidal behavior, we're talking about kids where that traumatic event basically collapsed that resilience. So for those kids, we need to be sure that somehow we get to them the message that they need to find somebody that they trust, a trusted adult that they can speak to. And if that's a problem, trusted friends that, and John, I would love you to talk about what the JED Foundation is doing there. That also requires, educating kids themselves about what they can do for each other.
Yes. Amy, you're raising 5 kids. How do you approach this issue?
Well, I appreciate the reinforcement of one trusted adult in your life. That's so important because it's not always going to be your parent that you can go to. But I think to Flora's question, One thing that we heard from the UK is that they were doing interventions for self-harm, but those were happening at age 13. When they actually did surveys and collected data, they found that the young people in the UK primarily were beginning self-harm behaviors at 10, 11, and 12. So collecting that information is going to be very important as we try to look for interventions, because they realize they're starting too late. And there are things we can be teaching at a very young age when it comes to prevention. Everything from how crucial sleep is, all the way to more serious interventions. But those are things that, no 5-year-old is too young to learn how vital that is. And then when it comes to what can the interventions look like to address cultural competence, it's a question we have in the United States as well. So I live in New Jersey. It has a very high population. It would seemingly have lots of providers, and yet we're in a rural area as well. And we are in a provider desert, and there are cultural competency issues there. And so that's been addressed most recently through telehealth. And we've seen a lot more access in that way. So the telehealth option in schools has been really crucial. We've also seen the introduction in places like Utah of a chat feature, Safe UT, and that's been a real success for Utah. And then nationwide, the introduction of a 3-digit number called 988. So previously, there was a long phone number. If you needed help, you were going to call this number, or people dialed the police, the emergency line 911. And that was not the intervention that was most helpful, because it might be traumatizing, it was very scary, you weren't going to have a provider arrive at the same time. So the introduction of this special number that was just as easy to remember, 988, it's going to take a little education of the public to begin to use that number, as well as funding to make sure the call centers have the appropriate professionals to respond. But those features have been introduced and can help when there's a crisis.
Yeah, and I'll just add, so we've talked about supportive adults. And supportive adults are a call to action that most mental health advocates and nonprofits are telling young people to do. Find and talk to a supportive adult. And so I would say to all of you in the audience, I think this is one of the calls to action. Do you consider yourself a supportive adult to the young people in your life? And do they know that? And make sure that they know that. This is a very, very important part of the safety net for young people, to activate the older adults around them, and to do that in a way that they know. In our research with teenagers about who they talk to when they're in trouble or they're in distress, they talk to their friends, as has been noted earlier. Some of them do talk to their parents or to their siblings or to their aunts or uncles, but the key defining issue or factor about whether they do or not is whether or not that person provides comfort and acceptance versus tries to tell them what to do. Okay? They're going to people that will listen and will provide comfort first, and that they feel are safe. And we also, I think, in this, because this conversation is about suicide, need to acknowledge that LGBTQ youth have a much higher rate of suicide. And family acceptance or family rejection is the key factor in terms of whether they're going to thrive or they're going to struggle related to their risk for suicide. So a very important part of this conversation is about acceptance and love for that young person when they do come forward. Many of them are afraid to come forward, and they're struggling in silence. Flora, your second question was about bringing young people into this conversation. How do we center them? How do we make sure they're in this conversation? And, we're all young at heart, I'll say, but we represent the older generation, the generation of supportive adults. So to the panel, how should young people be brought into this conversation and really lead it? Louisa.
Sure. This is what Hope for Depression Research Foundation is doing. Of course, this is a really complex issue. So just to get down to very specific, concrete examples, You know, yesterday we saw the SNF, The Run, and as I was heading back to my hotel, I saw all kinds of folks turning out for that run, and lots of parents and kids coming together. And at HDRF, we do have a 5K Race of Hope. It's a national race now. It's in New York as well as in Florida. And it's a really fun way for people to come out and talk about mental health in a way that's non-threatening, and to be together in a way that's non-threatening, and at the same time bring that issue into focus. And we've also heard that it creates a lot of conversations along the way. Not everybody is racing. A lot of people are walking, so they're walking together. Great way for parents and kids to start to talk is to walk together. So that's what we're doing to start these conversations, as well as, I mentioned before, bringing panels of scientists and other experts to the schools and actually in the classrooms to get the kids and make that a very safe space, to get the kids talking there. And we've had enormous success with that. That's been very profound and touching.
Terrific.
I think the young people always say, nothing about us without us. I think it is really important. I think they bring the young people, I think, in the whole campaign. I think it is about you. I think whatever we are doing is really, I think, helping you. And what we have gone through is just to try to run some school program. You only that time have to give them a lot of money, just a small amount of money, and ask the school children, I think, they form some activities, and actually then they start to build up this bondage. I think they start to feel comfortable, I mean, to share, I think, their anxiety and their worries with the mate. And actually, that helps a lot. So actually, the experiences from the school who have implemented this program, the school principal, they feel that, hey, now our teachers has less problem now. It's because the students themselves, I think they have built up some sort of supporting network itself. So I think it's very important is to get the students involved, get them participate, and give them the support, and give them a free hand too.
Great.
You know, one of the things that I'm seeing that's really interesting is in Colorado and some other states, young people are being hired as lobbyists for this effort. So being able to train young people not only to talk to legislators, but actually, you know, bringing them on and hiring them to do this work and empowering them to do the work of affecting policy change in the places where they live could be a really exciting opportunity to make the difference that they know is going to be important for them. Obviously, peer training is really key. We want to see that at all levels, but learning how to advocate for themselves is going to be, I think, a game changer.
Yeah. Yeah, so I would just say in summary to your question, Flora, about young people, your two questions I think are actually connected in a way, right? It's important for young people to lead this effort on mental health, right? Youth mental health. It's about them. They should lead it, just as the panel said. But older adults around them also need to become more accepting, right? To reduce the stigma, to let go of that legacy stigma and meet young people in this movement to normalize mental health and to normalize mental health challenges. And I think that's the opportunity that we all have and that this conference is really about. So thank you so much, Flora.
Thank you all.
Thanks, Flora.
Louisa.
Yeah. I'm sorry, Flora. I just wanted to address another thing. It's okay, you can have a seat. But I didn't want you to go away today without also addressing what you said about stigma and this girl not wanting to see the psychiatrist and the father not wanting to see the psychiatrist because we're not those kind of people. And I think that really crystallizes the fact that, or the need for the research, for biology research. Right now, psychiatry is really the only field of medicine that hasn't entered the molecular revolution of medicine. So it's not considered, high science yet. And I think that once we have a better understanding of the mechanisms, molecular mechanisms, circuit mechanisms in the brain that we can point to and treat, we will still have stigma because there will be so much misunderstanding, and misunderstanding is scary. So it is our hope that not tomorrow, but the research that is happening today will change the mental health landscape for the world by the time you're raising your own kids, by the time this young generation is adults.
So I want to bring up the issue of social media. As I noted, the Surgeon General put out an advisory in the US essentially stating that there's growing evidence that it may be harmful, and we should probably shift our thinking to that fact that it may be harmful, as opposed to a frame that it may not, it may not be. Paul, in your work in suicide prevention and research, how do you think about social media, and what do you recommend?
I think all the data has been suggesting that if the young people, they spend more time on social media, I think they're less well with their mental health. I mean, that is quite definitive. Whenever we talk to our young people, but now, social media is there. We cannot take this away. So I always say that instead the parents and then the children, they argue how much time that you can use on the iPhone, on the social media. I think we really have to join them in a way that they realize, I think, the possible negative impact on the mental health. But at the same time, I mean, they have to rely on this, I think, to connect with the friends. And also, there's a lot of time that when we take them away, we do not give them any choices, any alternative. I think if you take away, ask them not to use the phone, but if the parents are spending more time, I mean, to ask them to go to sports and then to do something else, then they have the choices. In Hong Kong, I mean, we live in a very crowded places. I think the parents are working long hours. So there's not much choices, especially during the COVID. We see, because now the school suspension, all this, it has caused a crisis of the mental health among the school children, because all this supporting system, all this alternative activities has been disrupted. So I always say the social media, it is a good servant, but a bad master. So we just have to deal with them.
Terrific. So we're now at the point in our discussion where we're going to invite Marianne from the SNF Youth Advisory Committee to come out and join us, and she will lead the Q&A portion of this discussion. So, Marianne?
I'd like to start off by saying a very big thank you to all our panelists for sharing their expertise on this crucial topic that is suicide prevention. But I think, we are opening the floor to questions, but I want to get the ball rolling. And I think if there's one thing that stood out to me during this conversation, it's firstly the need for open conversations, but also creating a safe space. So I'd like to know, how can we, and when I say we, I mean like the average person like Marianne and the people in the audience, what can we do to actually facilitate open conversations in places like schools and communities overall that will make people feel like they can talk about mental health without the fear of being judged and facing stigma, because those are the type of things that hold them back from actually talking about it or seeking help.
Yeah, thank you, Marianne. I'll start, if that's okay, and say I think part of the answer here is all of us, when we can, sharing our own experiences, right? We have an opportunity, I think, because of COVID, because that caused so much grief and loss and anxiety that it opened up a conversation that we can all have with each other about how difficult that is and that was. There's also a body of evidence that people sharing lived experience with one another is incredibly effective at reducing stigma and opening up conversations. So part of this is an opportunity that we all have to describe and to share our own vulnerabilities with one another in small groups and in larger groups. And you asked about schools, and I think that starts also with the school leaders and the teachers and the administration, creating those safe spaces and sharing their own vulnerabilities as well. What would you all add?
Yeah, I would agree with that. I think, after this conversation, none of us would be surprised if a few people came up and shared their stories. But it takes one person talking about it, and then people feel comfortable to do that. And so having that opportunity really is important. And to Louisa's earlier point, the idea that there's stigma around this because people don't know that there is recovery and that there's hope. And once we know that that's possible, then it's a lot less scary to talk about. People don't want to talk about something if it feels like a death sentence. When someone can talk about their journey, but also can offer that there are evidence-based solutions, that there are things that we can do, that there is a path, then more willing to, identify and say, me too, I've had that. And I think it's human nature to join in a conversation that's being had, whether it's, what your flight over was like or whatever the topic. As soon as you start that conversation, somebody else adds their experience, and that's just our human nature. So we need to start by being vulnerable ourselves.
Well, I think what happened is when the teachers, when they start to do the mental health training among the school children, actually the school children found it very exciting if they can hear the story of these teachers, how themselves to go through this. So I think it is a time that we really say that, hey, it's not just only your problem, it's everyone's problem. So we always say it's okay not to be okay. Just come and then we live with it.
Yeah, I echo all of this. And at the same time, I just want to point out how much we rush. We rush. This world is really, really stressful. So I think that the more we can support one another in the recognition that we're all in this rushing, stressful place together, meditation is a great, it's evidence-based for reducing stress and enhancing brain health. And then there are 3 words that I love in terms of being a supportive listener, and those words are tell me more. Because I think even in the parent-child relationship, I think the parent wants to feel that they know everything and can offer help, and they want to fix the problem. And oftentimes that's not what the youth needs in that conversation. They need to be heard and to feel heard. And so tell me more is a great strategy for that.
Thank you all. These were really valuable answers. I would like the audience to raise their hand if they would like to ask any question. And we've got people with microphones. Okay, that was quick. Can we start up there? Those are the first hands I saw.
Can I start here? Hello? Can I start?
Sure.
My question is to all the panelists. Mental health seems to be a privilege of the rich nations. But mental health concerns are a global concern. It is a fact that there is a serious shortage of mental health professionals all over the world, whether it is psychiatrists, psychiatric counselors, clinical psychologists. Why aren't we talking about or even thinking about collaborating with other influencers in the society, such as faith leaders, healers? Because they have influence, they can influence the adult mind, and that is a destigmatized space. And they also talk about healing. Why are we only constraining ourselves to mental health professionals and not broadening to bring collaborative partnership, which is respectful of each other's skills and influence in the mental health spectrum?
Yeah. Thank you. Amy.
Yeah, thanks. That's a great question, and it's one that we talk about a lot. I think you're right on with that question, because what we're doing, we're seeing different pilots where they are training not only faith leaders in this, but barbershops and hair salons and other places where you go and you spend time where there may be more trust. Because as you mentioned, I do have 5 kids. They're not always going to come to me. You know, my oldest has a very close relationship with her piano teacher. That's who she talks to and trusts. And that's who she goes to for advice. And I have to respect that that's an important place. Other communities, there's such distrust of medical professions that the faith leader, the spiritual leader, may be the one where we see a deeper connection and a deeper trust. The hair salon, you're sitting there, you're in the chair, someone's trying to make you feel good. That's the nature of the person providing that service. And so by training them in some very basic interventions and also when and where to connect someone to a service is going to be really important. We know that there's even, you know, just the training of grandparents that come to sit on a bench where someone, a youth can sit and talk to someone else's grandparent. It's not necessarily their own, just another adult who's there to listen. So those are really key, and especially in places where there's less of the healthcare provider system.
Yeah, I would just quickly add, I think what you're asking about is the key to youth suicide prevention. We know we have an access to care problem all over the world. There's a shortage of mental health workers, and we need to address that. But the real key to success is activating the community. It takes a village in exactly the ways that you're asking about. You also talked about wealthier nations versus poorer nations, and there's a really, really important suicide prevention point in this also. People that are at socioeconomic disadvantage struggle more with their mental health because they have to deal with so much more that's additive stress. So things like affordable housing, basic incomes, minimum wage, universal health care, these are suicide prevention activities and initiatives, and they need to be part of this conversation. If we want to reduce suicide, we have to have a humane and adequate safety net for human beings.
That's right. If you care about mental health, you care about climate change, you care about gun control, you care about housing, you care about all of these other issues, and you can be advocating in all of those areas because they are adding to the social supports and stressors.
Well, I think the title of the theme is called release. I think is if we can release, I think the community resources, I think to mobilize the community resources, I think to hold those people in need is very important, because for someone who are vulnerable, disadvantaged, low income, there must be much limitation. That's not much how much they can do. But if we can release, I think the community, the resources, the school resources, and then to build up a more caring community, I think that would help.
Would you like to add?
Oh, it just seems to me that we're talking now about prevention on an entire societal and government level. I know in the United States, the Biden administration has put mental health at the top of the national agenda because they do see that as a lever issue, not just a moral issue in and of itself, but as a lever issue that's affecting every aspect of life in our society. So I only hope that can be a model for other governments internationally, but it's, you know, I'm not educated in that respect.
Thank you. We did have a couple of hands of, oh wow, loving it. You can go.
Thank you for your nice conversation. I have 2 questions. One is something that I saw in downtown Athens. I was walking by a church, and they had a big sign outside the church saying that people that they are going suicide, it's because they find a weak solution. And I'm wondering about physical health. Medical associations usually, if people give wrong information, they intervene. But when it comes to mental health, no one seems to bother about this. And my second question is, because I'm a preschool teacher and a psychology student, if it is necessary to train teachers and parents to learn to be energetic listeners in order to help children to express their feelings.
Well, I think that's very important. I think it's as the basic knowledge of the mental health, I think raising the awareness, and hopefully I think they can buy in their attitude and then they change their behavior. But when they change their behavior, you need to have infrastructure support. I think the school teachers will complain if I have such a packed curriculum, if I have long hours, I just don't have time. And if you ask the parents, no, I do not want to spend time with my children because I have long working hours. So I think that is what I'm saying. You need to have a system change. You need to have everyone can contribute something. If you are the boss, be nice to your employee. I think if you're school teachers, and then try to spend more time, I mean, with your school children, I think we do need to work together on this.
We're seeing, that of course teachers are tapped out in their time and their training and feeling exhausted, but we haven't made the shift in the United States to include this as part of the examination requirements for a teacher preparation graduation. And that's where we have to move a little bit further upstream. It's not enough to just train the teachers who are already on the job, but what about those who are incoming? And make sure that that's a requirement not only for educators, but for doctors. Every doctor should be trained in this. Dentists, right, should be able to know the signs that they're looking for eating disorders. We should be training coaches as they're moving up through the profession. What should they be looking for? And so to the public awareness campaign that you're talking about, the misinformation, I think, unfortunately, it's not just the billboard. We're seeing it on social media. Where do kids go for information? Their first place they look for information about their own mental health is online. And there is so much misinformation there, lies, that they're being fed that we need regulation on, to your point, and we need to be able to say that what you can find online is going to be a health benefit. Instead, they're finding a lot of things that actually can make the situation worse.
We do have a question from the SNF Nostos app. Someone's asking, teen suicide is often a product of impulsive actions, following relationship difficulties and substance involved, social media, lack of social constraints are exacerbated factors. How do we address this?
Yes, this is certainly true. And one of the most important, and I'm so glad this question was asked because it was something we wanted to talk about, one of the most important suicide prevention methods is what's called means restriction. So suicidal impulses can be impulsive, but they're fleeting, they pass. And so we want to make sure that people do not have access to lethal means for their suicide attempt. So in schools, for example, this means that we have window guards and rooftops are secured. In homes, it means that medicines are secured, right, and not available, or, in small quantities, that firearms are stored. Because that way, if somebody doesn't, has having that suicidal crisis and impulse, and they don't have access to a lethal way to harm themselves, it will pass, they can get care. And most people who think about attempting suicide, even those who do attempt suicide, most do not attempt again.
Unfortunately, that is all we have the time for. I do want to say that you guys are more than welcome to reach out to our panelists, as it was mentioned that you are expected to be sharing your story, so please don't be shy to continue the conversation. Even if you take it to social media, we have the hashtag refocus on mental health, because like we said, if you want to hear people get vulnerable, you need to be vulnerable too. So we're super open to hearing your thoughts on this conversation. Can we have a round of applause for our panelists?
Thank you. And for you, Marianne. from Marianne and Flora. Thank you.
Thank you so much. So now we'll be connecting to the dome at the Stavros Niarchos Foundation Cultural Center. There, for the past 3 days, children between the 1st and 6th grade have had the opportunity to explore sports, theater, and many other art forms as part of the program called Field of Life. So Field of Life was established with founding support from Stavros Niarchos Foundation, and we'll meet the Chief Operating Officer of Field of Life, Dimitris Yanakakis, who'll be telling us what exactly they've been up to over there. Over to you, Dimitris.
Hello, thank you for joining us here at Tholos. It's been an amazing 3 days at the Gnosis Festival. We've been here, we welcomed about 150 kids, first grade to 6th graders from all over Greece, mainly Nicaea, other places of Attica, but for the first time we had the ability to welcome families from the 3 corners of Greece, from Kalpaki in Epirus, Greek-Albanian borders, Nea Visa, which is in Evros, the northeastern corner of Greece, at the Greek-Turkish borders, and from the remote island Tilos, it's a magical place. And all of us came together in these 3 days. They joined programs that had to do with basketball and art, culture, and education. The 3 pillars of Field of Life, sports, education, and culture. We are true believers that if those 3 pillars are co-developed, the kids get all the perfect basis to build a strong character on it. And this is what we're thriving for. And we have the enormous and tireless support from the Stavros Niarchos Foundation, who helped. Thank you very much. And we're trying to achieve with everybody here and through our clubhouse that's coming, a fast upwards, which is our sign as well for every kid.
Thank you very much, Dimitris, and thank you all for being here today. Right now is time for lunch, so you can head on over and grab a delicious meal.
See you there.